Alrighty, so one more day in the week. Um, been working hard all week. This week has been mostly consultations. Last week was working on our home cooking 101. I'm still working on it. Lots to do with that. But 70s in Vermont today. Whoa. Your Yorkie scratched her cornea yesterday. Ugh. Okay, so we want to talk about Bloodshot Eyes. Somebody asked me that if I would talk about that in the supporters group. And here's the thing with eyes, you don't want to mess around. Uh, it's so easy to lose an eye. A scratched cornea can turn into a perforated cornea, which can turn into a lost eye. Uh, the eyes are, from a TCVM, Chinese medicine perspective, the eyes are the window of the liver. So a lot of times people will bring their dogs or cats in and they'll say, well, his eyes have just been so bloodshot. The whites of the eyes are just all red. And, I figure he's got something going on. And most people think, well, it's a little conjunctivitis, it's a little infection. We sort of equate it with pink eye in our kids. Well, sometimes it is conjunctivitis and it's an infection, but sometimes it's something much more significant. So a scratch on the cornea, they'll usually be blinking, kind of holding it shut, might be hiding where it's a little darker. If you've ever had a scratched cornea, I can tell you they are extremely painful. Most people get morphine for scratched corneas. That's how bad they are. But our dogs and cats are just kind of like, okay, I'll hold my eye shut. Sometimes you get a watery eye along with it. And if you ignore it, sometimes you'll see then the cornea, the front of the eye, will start to turn cloudy around that area as it gets swollen, and the eye will get red. You don't want to mess around with those. They need to be treated very quickly. Usually they're treated with antibiotic drops. Sometimes they're given some sort of an anti-inflammatory or pain med to make them more comfortable. And one of the things that we would use, particularly on those ulcers that refuse to heal or were slow to heal, for instance, boxers, pugs, those guys with the buggy eyes, they get something called an indolent ulcer. We actually would draw blood, spin it down, and use their serum as an eye drop. Wonderful, wonderful way to get eyes to heal. And that's one of the things we look at more for holistic medicine. How do we use the body to heal itself? And serum is incredibly healing. Other things that can cause red eyes. We can see red eyes with glaucoma. So if the pressure in the eyes is going up, that's glaucoma. That is very dangerous. They can lose vision within 24 hours. So if you suddenly have these kind of bulgy looking, bright red eyeballs, that's an emergency. Don't wait, get them seen because you don't want them to lose vision. Even if you get the pressure down after 24 to 48 hours, you still may not regain vision in those eyes. But non-eye related diseases that can show up as bloodshot eyes, lymphoma, cancer, liver disease, hepatitis, inflammation that involves the liver can show up as just red eyes. That might be the only thing that you'll notice. And I used to get very nervous when I would have people bring their dogs in with these bright red eyeballs and the dark red, brick red tongue. I call it toxic red. And I would take one look at those dogs and say, oh, we're not just dealing with the eyeballs here. And people would look at me kind of funny and say, why do you want to get blood work on my dog? Why do we need an abdominal ultrasound? Why do we need x-rays? I brought him in because his eyes look infected. Well, nope, that's not a conjunctivitis. That's something much more sinister going on. So you never want to ignore a red eye problem because you want to jump on those problems immediately. Things that you can do at home to help: treat the liver, drain the liver. So milk thistle, dandelion greens, dandelion root, those are the kinds of things that we can use. Our little Georgie has paralysis of his face muscles, so he can't blink, and he's on eye drops about 6 times a day. He's on different ones. And interesting that he has eye problems. Part of his problems, he was born with dry eye, but that's pretty much under control. But he's also had liver failure at least once in his little lifetime. He's had stomach ulcers a couple of times, which is all heat rising up to the eyes. So from a holistic standpoint, we don't just look at one organ or one body system and say, okay, well, it's just localized there. No, we want to look at how that's connected to other areas of the body and not overlook the fact that we might need to be treating more than one thing. Okay, I got lots of work to do today. Heat is back in South Jersey. I am a big fan of heat, let me just tell you. So, going to be real happy today working out in the greenhouse and in the barn this afternoon. And tomorrow I get to do really fun jobs, at least they're outside, things like cleaning the chicken coop. I know nobody else would get excited about that, but I am. I'm excited. How do you differentiate red eye from pigmentation? Oh, it's very obvious. A pigmentation is going to be black. Red eyes, it's bright red. Do dogs with blue eyes have more issues? No, not necessarily. 50s on the western slopes of Colorado. And my son just got back from skiing in Taos. Have a great day.